Welcome to Joint Effort PAs, where two orthopedic surgery PAs get real about life in medicine. From tips and tricks to professional growth, work-life balance, and everything in between. We're here to share what we've learned and what we're still figuring out. Let's get into it. Let's take a look at this.
Yeah.
Let's take a look at all of the things. This is like an episode on the curbside consults.
Yes. We touched on this when it was very specifically coworkers.
Yes.
But I think what comes along with being a PA and then your friends and family know, friends and family, at least my family, doesn't really know what a PA is.
Mhm.
You know, like sometimes they say PT, sometimes they say like medical. It happened last night. Well, we'll get to that. But I think now that you like went to school and you work in a doctor's office, now everything's on the table for, hey, can you take a look at this?
Mhm.
Hey, can you tell me what to do about this?
Yeah.
Hey, my foot hurts. Can you look at it?
Yeah.
And it happens all the time.
I mean, now your husband knows, I assume, what you do. So
My husband does know what I do.
yeah,
I think
he's like the only one in your family that is aware.
Yeah, my kids still don't really get it. But anyway, I think once someone learns that you are capable, now you are their go-to person.
Yeah.
And there are no boundaries.
Especially for you.
No, there's no boundaries. Yeah. So this episode is called, hey, can you take a look at this?
Yeah.
And if I had like a dime for every time I heard that, I'd be rich.
Beth would be rich.
I would be rich. Yeah. But here's like the real psychological part we're going to dive into. We do take a look at that and we will entertain all the things.
Yeah.
So we're going to go over some stories that we've had.
Yeah.
And these are real.
Yeah. These are all real life, real case scenarios, real case studies, if you will.
Real case studies, if you will.
Okay. So story time. Well, first off, before we get into it, we should briefly dive into the weeks past because it was a whirlwind. So mine will be brief, at least because it was such a whirlwind.
Right.
But
so
I had a full week.
Yeah.
We did 23 cases this week.
Yeah. You're projecting onto this week as the things you don't have to talk about.
Correct. Yes.
Yeah. Your last week was a good week.
Last week was a good week. Like a lot of new and different cases. We did like a humeral shaft fracture, a periprosthetic humeral shaft fracture.
Yeah. Which is scary but good. Right?
Yeah. And a olecranon, distal humerus, like a supracondylar type deal. Those are fun. The humeral shaft is like fun, but also I couldn't really see anything the whole time, just like me somewhere protracting. So like not fun in a sense.
You.
We did a ton of cerclage.
Yeah, you had to.
Yeah.
Yeah. There was no place to put any hardware, right?
And yeah, we did some finger fractures. We did a couple more, we did another thumb implant. So it was great. It was a really busy week. I don't think I left the hospital until 7:00 or later every night that we were there. And then my doc is out of town for a full week and then only back for like a couple of days the next week before leaving again. So I'm using this coming week. Yes, I still am seeing patients on my normal 3 days, but then I took our OR days off because I'm partially anticipating that like I'm going to plan to get my life together those 2 days, like clean my car and things leading up until the inevitable 3 weeks from now when shit hits the fan because it's going to be so insane. Yes. I will have at least parts of my life taken care of. So,
I mean, that is good planning.
Yeah.
Yeah.
That's what I feel.
Yeah, definitely.
How about you?
We had a good week. I was off the week before. So coming back, it should have been a crazy week. And it was and it wasn't. We had our hospital cases on Tuesday. And the day before, there was a cancellation because our fill-in for surgery scheduling posted a case that was out of network. And this was like a case where we'd order a graft where it was an oats case. So there's a lot of moving parts. So graft got ordered, patient's out of network. Can we do the patient the next day? But then I can do them 2 weeks out. Is it a new graft? Do I have to send it back? Like whatever. I was annoyed. I was like really annoyed that got canceled. And then we added on someone the week before when I was gone. It was a 16-year-old, didn't speak English, ACL. And then Monday, pre-op by phone. I was like, that's a terrible idea. Why did we do that? I was there, but why did we decide that? So the kid doesn't pick up his phone. Then he does. tell him what time to get to the hospital. So go to the hospital the next day and he didn't show up. They tried to call him and they couldn't get. So anyway, he's 16. It's not his job. Right. So they finally get a hold of him. He's like, hey, my dad's car broke down. Like I feel bad no showing, but I didn't show because of that.
Yeah.
I was kind of like, yeah, but this was set up to fail. Like I knew that little feeling of like, this is a
You had
bad
the gut instinct that like something wasn't right.
I knew it wasn't right. I knew we shouldn't have done it, blah, blah, blah. But anyway, we did. Actually, we didn't because he didn't show up.
He didn't show up.
So our surgery day was cut short. I spent the entire afternoon getting all of my variables with scheduling down. And I went old school. I printed out calendars, went with a pencil and an eraser, and I fixed 5 or 6 like looming problems that we had.
Oh, sometimes you do need like a good pen to paper.
It was pen to paper. Yeah, there was no other way.
Yeah.
There was no other way.
I hate those though. Side note, like the quick pre-ops right before. And sometimes it's inevitable. Like I'll pre-op somebody for surgery the next day for like a trauma. Break your wrist. You're out on my schedule Monday. We're planning to fix you Tuesday. Yeah, like I don't mind those, but like planned things that require some stuff going into it. That was one of my qualms of the week, was like seeing pre-ops too close to time, because I saw like a pre-op for a total and we're supposed to do it in a week, or it was less than a week. No clearances back. The scan had just come back. They don't have their labs or anything. So as I'm doing the pre-op, I'm like, there's really even nothing for me to review right now, because like, how am I even supposed to do the pre-op? And how do I know that you're not going to get like canceled now leading up? Because
those are all big ifs.
Yeah. And then I did the next thumb implant that we did this week. The name was like kind of recognizable, but not super recognizable on the schedule. And I knew we were doing a BioPro, but like always current me thinks that past me had it all under control. I'm like, oh,
I did not set myself up for failure.
I wouldn't set myself up for failure. But the day before that case, I saw that patient for a pre-op, and our like the national person in charge of like the company, the main guy of the company, was coming flying down for this case, like not our normal local rep. So it was like I don't know, we didn't want this case to go well, you know? So I see her, and I had made note in my last H&P. I hadn't seen her for like 5 months. And I made note to myself, make sure we get x-rays at her follow-up to evaluate the quality of her
You
trapezium.
Were setting yourself up for success.
I was, but it was the day before. So I hadn't x-rayed her in 3 years, and I get them and I'm like, holy shit, like
we can't do
this one looks not like the best.
Yeah.
So I'm like panicking, texting our other reps like, oh, can we have this on backup? And I'm like, oh, God, like this is the one that was supposed to go perfect and well. And I mean, it did. It actually fortunately did. And they were able to make a post on it on how sometimes it can be used to correct such severe deformity.
Yeah.
And so like that went fine. But like I looked at it and I was like, okay, I have to remember to talk to my doc tonight and be like, hey,
yeah,
is this okay?
Yeah. We talked about that a couple of weeks ago. I had a patient that I was seeing, and it was multidirectional instability, which is not a imaging find. It's like your hands have got to be on the patient. You have to understand like how their shoulder moves. And I trusted my former self, and I was so confident I set this patient up for surgery, but I made a note, like talk to the doc about this, because he's going to review this and be like, hey, imaging is normal. What are we doing here?
Yeah.
And I like lost sleep over it.
Yeah.
But, you know, just because I trusted my past self to set my future self up for success, and I doubted her.
Yeah.
My current self was like, what the hell was she thinking?
I will say the times I've been the most burned are the times that I haven't even had that forethought of like, oh my gosh, I'm a little bit worried. I need to review this.
Yeah.
So usually when that's the case, it ends up being okay, knock on wood. But
yeah. And we had another case on Tuesday, which was like the shortest, most anticlimactic day. We had a patient who was on Eliquis for shoulder surgery, right? So we get them off and it's 2 days. It's always been 2 days, right?
Yeah.
I mean, I was talking to our total joint PA and he said they do 5 days, but it's always 2 days, right?
Yeah.
So we get to the hospital and the new anesthesiologist was like, hey, so it's 3 days. I can't block your patient. I was like, but last week it was 2 days, and every other day before today, it's 2 days. I've never had an Eliquis patient that the anesthesiologist has ever balked at anything.
Yeah.
So this patient did not get a block, gave him some local, fast forward to 6 p.m. They're like, oh my God, it's so bad. Like, you know,
Yeah.
I was like, that was super annoying.
Yeah.
You know, but other than that, I guess the days went okay. I have a rotating medical assistant because I'm waiting for mine to start. So Every day was a new day.
Mm.
But I tempered myself correctly, hopefully.
Yeah. And then you'll have something more permanent and you can focus on the training, I guess.
Yeah. But we did another Misha. That was cool. We hadn't done one
Yay.
in a little bit, and we have another one coming next week. So
Love
overall,
that.
it was a good week. It was not as treacherous as I thought it was going to be as I was away for a week.
Treacherous.
Treacherous. That's a good word, right?
It is.
Okay.
All right.
Back
Story
on
time.
topic. Yeah.
Story time. Okay. So first on the docket, splinter removals. Removing
Okay.
splinters.
So
your story on this.
I have a story on this. So I had, it was a year ago, my sister-in-law and brother-in-law brought our nephew down. We see him once a year, right? And he's moderately autistic, so the sensory thing is a big deal. He's 8. They come over for dinner, so set up for, oh my God, so good to see you guys, whatever. And it was like, hey, do you mind taking a look at the bottom of his foot? I think something got in there.
Mm-hmm.
So I was like, okay, did anyone tell him I was going to do that? They're like, no. I figured there'll be so much going on. He'll be so distracted. I was like, that's cool for me, right?
Yeah.
So I look at the bottom of his foot. It's infected. Like it's infected.
Like near his heel or?
In the bottom of one of it. No, in the bottom of the foot. Like right in the pad of the foot.
Yeah, okay.
Like, how is this kid walking? Like, it looks like it's red. There's white. There's pus. There's all that. I was like, okay. So, I'm trying to talk to him. I'm trying to explain to him like what a splinter is.
Yeah.
Now I've got my like eye tweezer, like pickups or tweezers because like I didn't have anything at home knowing I was going to do this. He's screaming. He's crying. I kid you not. I pulled out of this kid's foot what looked like a toothpick that was the size of like a pencil eraser.
Oh my God.
Like, it was so satisfying, but at the same time, are you kidding me? And now like, I'm pretty sure he's like scared of me.
Yeah. Well, he is.
He definitely is. Yeah.
Yeah.
But I was like, what in the world? So, and fast forward to a year later, they're here now. And I just got a picture on my phone of his thigh that looks to me like a spider bite. But they're like, hey, do you mind taking a look at this? I think he has Lyme's disease. I'm like, I mean, definitely not in my wheelhouse.
Yeah.
But I also found myself giving advice.
Yeah.
Like, hey, I think it's a spider bite.
Like, it's enough in your wheelhouse though that.
But like, I didn't shy away from it. Like, I very much, okay, but I was set up with the splinter. Like, can you? Once I looked at it, I was like, someone needs to.
Like,
It was the weekend. It's not like they were going to go anywhere. So it was a little bit set up. So it was a choice that I decided to like dig at the bottom of his foot. And now he like has like an issue with me. Well, maybe he doesn't, but I assume he does.
Yeah.
I mean, it was a choice.
You with that.
And with the rash, I could have just been like, hey, yeah, no, that looks totally Lyme disease. And thought in my head, that's not Lyme disease. But
yeah, but then I don't know. I don't want to be like lumped in with somebody who's wrong.
I don't either. I didn't want to comply with like the advice when I didn't agree with it. But then I'm bold reaping it. Like,
now
I'm all in.
You are. Yeah, now you're a
in.
part of it.
Yeah.
So.
But yeah, so that I get asked a bunch, or like, can you look at this like rash that I have? Like,
rashes are my area of expertise.
They're not, and I'm like, prednisone, dude. And even when you get to the dermatologist, guess what it's going to be? Prednisone.
Yeah.
So
ChatGPT it. I don't know.
Yeah.
What did you do with your dad's ear?
Oh my God. Again, the next thing. So my dad recently had a total knee, and I set him up at our practice to have his total knee done. Long story short, long story long, he came in for his hip, got an x-ray of his hip, then got an MRI of his hip, which I didn't totally agree with because he's 75. It's either arthritic or it's not. Took 6 weeks to get an arthrogram, which is what was ordered. Then he came in by that time. I literally was just like, can you give the guy a shot? That's what I set him up for. And I thought I was doing a good thing, but it turned into 6 weeks. That's the arthrogram. Comes back in. Guess what? It's arthritis. By that time, hip's not bothering him. It's his knee. So he goes in for the hip discussion visit. And I'm like, hey, it's arthritis. My dad was like, cool. But my knee, and he's needed a knee replacement. He's like, you know what? My knee hurts more. Let's talk about my knee. So he leaves, signed up for a knee replacement. So I'm like, Dad, did you get a shot in your hip? He's like, no, they didn't talk about my hip. I'm like, oh my God. Right. So when we talk about the knee, he goes, well, they want me to get primary care clearance. And I'm so pissed off at my primary care doctor right now because I've got a double ear infection. I'm like, Dad, you're 75. Like, you don't have a double ear infection. You're not a toddler that goes to preschool, right? It's been going on for 2 months. Okay, first of all, I said, Dad, it's not an ear infection. They sent me to ENT. They gave me these stupid drops. It doesn't work. I can't hear out of my right ear. Now it's traveling to my left. I was like, okay, listen, 75, and again, I'm doing a boards thing right now. Most common cause of hearing loss in a 75-year-old is earwax impaction.
Yeah.
So I'm like, Dad, I go to the urgent care and get like the lavage.
Yeah.
I don't trust anybody. I'm not doing it. How about when you come down next time, you can do it? I'm like, and I said, okay, right?
Yeah, sure.
So
of course, yeah.
hydrogen peroxide, a little bit of saline. Of course, I go down there. I forget all supplies. So I'm like, Mom, what do you have? That's a syringe, right?
Yeah.
So she's got like a turkey baster. All right, whatever.
Perfect,
This will do. So I got my dad's head on the counter, lavaging his ear, whatever. Guess what? Fix the problem.
Yeah.
Yeah. Like, is it in my scope of practice?
Yes.
Well, I mean, I was more mad that no one else would do that.
Yeah.
2 months later?
Yeah.
And no one else would do that?
Yeah. I like to think of myself as somebody who will do just about anything. And sometimes that burns you, sometimes it doesn't.
Yeah. So let me ask you about your dog, Hannah.
R.I.P. Rooks. And I didn't kill him by this. Just throw that out there. He died by other means of old age or cancer or something years later. Honestly, I mean, what I was trying to aspirate could have been the cancer.
Okay, back up. So
back up.
The dog.
Yeah. Okay. The dog had a very large mass on its neck, like near its throat. And like old dogs get like lipomas and stuff. So like I know what a lipoma feels like. This was very much like a cyst. Like it was fluid filled,
squishy.
I mean, it was squishy. Like you could tell. So my parents were like, "Oh, we're not going to take the dog to the vet. Like we're not those kind of people. Not that like they're not bad people, but like we're just not like take your dog to the vet for everything kind of people." They're like, "He's probably dying anyway." God. So I was like, "Well, like it's fluid filled, so like I can like take some fluid out, right? Like I guess I can aspirate his neck just like I could a person's knee or something, right?
Ganglion cyst on their not neck.
Yeah, exactly. Easy. It'll be easy." So I brought home some lidocaine and a empty syringe and an 18 gauge needle and tried to have my dad this sounds like a torture story now, hold down the dog so that I could aspirate his neck.
Did you do it?
Long story short, it was a dry tap and the dog wouldn't the dogs don't cooperate. And perhaps this is the reason that I shouldn't attempt these things on animals, as not being someone who is in veterinary medicine, because they're really hard to like control and you can't sedate them. So like he just wouldn't, even like with being held down and he's a smaller dog, like they're just not letting you do anything.
Yeah. And you can't talk to them out of that.
I'm not like, just calm down for 10 seconds. Okay. And then you'll stop feeling it.
I also have tried to do stuff on my dog. My 2 dogs got into it, and then one of them had like a full thickness like laceration.
Yeah.
Like this needs a stitch.
Yeah.
So again, I had my husband like hold the dog down, headlock, and a second I touched the dog's skin, bucked, went crazy. I was like, I'm way
dogs.
over my head.
Yeah.
Way over my head. This is stupid.
Yep.
And we brought him to the vet, and the vet was like, we will need to literally put them under general. I was like, okay. That makes me feel better.
Yeah. Yeah. Like, so it wasn't just me.
But what is it about us like that we're like, yeah, you can.
I will say the only success story I have had with it is when I had chickens, one of my dogs got into the chicken coop and it pulled out one of the like, I'll call it a teenage chicken. It was like not quite full grown. And pulled it out.
So it was a child.
It was a child, and it drug it around the yard, like playfully. It wasn't trying to kill it, but it was like, just had it held in its mouth, let it go finally, and it was bleeding, and it had a huge laceration across its neck. It's always necks. And like for a chicken, I guess that makes sense. That's where I picked it up from. But I had monocryl in my house, and I was like, I'm gonna suture the chicken's neck because I don't have to take these out. I'll just let it dissolve. Like it'll be fine.
Perfect.
And the chicken was actually very cooperative.
Interesting.
So like we held down the chicken
because it lost so much blood, or
no? I think just because like it was so startled or traumatized.
Yeah.
And chickens, if you put them like in a certain position, I don't know if they're like sharks or stingrays or whatever, you can kind of like get them in like a cathartic state where they really don't move. But we held the chicken down and I stitched back together its neck, and then I kept it like quarantined in my house in a little Tupperware container for a week, let him recover. And then I set him back outside and reintroduced him to the flock. It was great. 3 days later, a hawk came by the house, picked him up, and ate his head off, and I found him dead.
Oh my God. I was not expecting that turn of events, but I think you gave him a couple extra days.
I gave him a couple extra days. Yeah.
It would have been, I think it was tragic. Like it was tragic in general.
It was more tragic for me when the chicken died after I had put all that effort into it. I was like, fuck, why that one? Like, why did you choose the one I just nursed back to health to maybe like the hawk could sense it was like the least well of the chickens? I don't know.
That's insane.
Yeah, I just came home from work and I found it beheaded in the yard. And I was like, what the fuck? Like,
God, that's
all that work.
But that's also like an F you right to you. Like,
the
hey,
hawk,
you tried. Look at that. And the hawk's like,
yeah, never
I see.
again.
Yeah.
Mm.
Oh my gosh. I had, this was like a couple years ago. We were at a party at a friend's house. It was over the summertime, and there was an in-ground pool and everybody was pushing everybody, and someone pushed somebody, and instead of going into the pool, they landed short and shin to concrete. Instant, right? So looking at it, or, you know, I don't even think I saw it happen, but they were like, hey, is it, you know, but Beth works in ortho. Can you take a look at it? It is like filleted open.
Yeah.
There's subcutaneous fat everywhere, right? They're like, hey, do you think this needs to be fixed? Well, yes, it needs to be fixed.
Mm-hmm.
Like,
I do.
And I have suture stuff at home because we cover football and whatever. So I was like, do I engage and be the person, or do it, you know, we just tell them to go to the ER and spend the entire night there and disrupt everything? So I engaged, right?
Yeah.
So went to my house, got my stuff, came back, literally sutured up her shin on her bed, sterilely, maybe. I think.
Well, I mean,
hopefully,
half sterilely.
Yeah.
That's like sideline.
But yeah, and then after, you know, afterwards, they're like, oh my God, you can never go out, and like, how do you like let your guard down, and how do you exist? I'm like, well, you guys asked me, so the answer is I don't hang out with you.
Yeah.
That's how it happens. Like, I can't hang out with you if you guys know that I'll do stuff. But it's a self-fulfilling prophecy. Like, they'll continue to ask if I continue to do.
Yeah.
But I'm not going to look at a juicy laceration and
say no.
send it somewhere else.
No.
And then criticize how shitty it was closed.
Yeah. How
right?
do you do that?
I don't know.
Yeah. That's why. That's part of the reason why I say yes, because like I want to have my hands in everything.
Everything. Yeah.
Literally in everything.
Yeah, but yeah, I mean, I can keep going. Like my husband shoved an oyster knife through his hand day before Easter.
Ago, right?
Mm-hmm.
Yeah.
So sutured that up. He had a recurrent cyst on his elbow.
We just addressed this issue.
We did.
Yeah.
About 10 minutes ago.
On the back of the elbow. Yes. I don't know. We were hoping it was a teratoma.
I think it was.
Yeah.
Like when I talk about it in the future, it was.
Yeah.
Yeah.
There was definitely a tooth inside of it.
Yeah. This was a recurrent cyst. This is a recurrent cyst on the back of my husband's elbow that I attempted to excise a year ago. I did partially. It was gone. And then it recently came back.
Yeah.
And I sent Hannah a picture of this that I actually marked up with a heart around it.
Yeah, it's cute.
Because we excised that today.
We did.
And it was a 2-man job.
It was. Yeah. It was bigger than I anticipated, or just surrounded by more adherent things.
Yeah. But theory is he leaned on something got in there, and then there's calcification around it. But what we pulled out at the epicenter was a tooth.
Yeah.
According to him, it was a baby jaguar tooth. According to us,
tooth.
it was like a baby dog tooth.
Yeah.
Which arguably probably was in there for years.
Yeah. Like, did one of your dogs when it was a puppy, like,
it's probably.
And then like it went inside of his elbow, and or it's his twin.
It's his twin, right? We also said that it's a mini him growing inside of his elbow. Correct. Like a Danny DeVito situation. Like the other version of him.
Yes.
But is it ego driven?
No, maybe a little. I don't know.
A little bit.
Yeah.
A little bit.
I like to say no, but probably.
Well, here's the thing. We should be able to excise a cyst on the back of someone's elbow.
Yeah.
We know how to do that.
Yeah.
If I were seeing that as a patient and it was a cyst aspiration, I can do that.
Yeah.
But that was not aspiratable.
That was not an aspiration thing. You can't aspirate a jaguar tooth out of somebody.
Again, like more psychological. Are we just people pleasers?
Mm-hmm. Correct. Yeah.
With a side interest in procedures.
Yes. I think we have a procedure obsession. Now, I'm not going to try to lump myself into the procedure goblin that we have discussed before because I don't want to be that person.
No. We're just dabbling, like a little toe in the water.
Yeah. I have interest where my interest should be, I think. I feel fine. Like, I'll take some cysts and lumps and bumps out. I'll do some splinter stuff. Now these are patients, but like I've taken fish fins, like the little spikes out of patients before. Somebody came into urgent care like 4 weeks ago and had like a fin from bass fishing or some sort of like spike from their fin lodged in their leg. Like,
on
the side of their lower leg. And they were trying to check in and everybody was like, no, I'm not going to do that. And I was like, I will.
Yeah.
So
I'm free.
We did. Yeah. I got it out. It was a pretty decent sized fin. I've taken out, actually multiple fish fin situations. There's a lot of that.
I had a patient. It's actually one of our reps' kids. This was Easter weekend too. Just happened to not be the oyster knife in the hand weekend, just a couple of years ago, many years ago. And they were fishing and brother A casted the line into brother B's forearm. So it was like a deep sea fishing hook. The hook was in the forearm.
Yeah, you can't just pull those out.
You cannot just pull it out. So I got a text from the rep, and the rep was like, "Hey, so got like a problem." And again, could they have gone to the ER? Sure. Yeah. Am I fully capable of doing that? Yes. So I did. I had him come in here, numbed it up, pushed it all the way through, cut the hook off, and then brought it back out. I think it was very
How'd you cut?
satisfying.
Oh, like, so like you push all the way through and then you cut the line and then.
No, I pushed all the way through because it had like a little dagger on the end of it. So you can't like pull it back. Right. So I used a ring cutter to cut that. Then I pulled it all the way back through. Yeah.
Nice.
Yeah, it was great. And I told the mom to put it in his Easter basket the next day. I don't know if she
amazing.
did. Yeah. But
just you told your husband to play with his cyst afterwards.
I did. I told him it was okay. No judgment. Yeah. No judgment. But I think you and I are both, we identify with that part of ourselves that we like to do the hard things.
Yeah. You don't get better without trying to do the hard things.
That is true. Yeah. Now, what's the line?
What's the line?
Yeah.
I mean, I feel like I have a pretty good sense of like when something's like, that's like really outside of my scope. Like true general medicine stuff, I really try not to mess with.
Yeah.
Like, I'm not going to switch my patients' meds up if they ask like, oh, my primary care doctor, like it's so hard to get a hold of them and like my blood pressure is all over the place. Yeah, could you just like help with it? No.
Yeah.
I mean, I will prescribe like, I will help with some primary care things. Like if, they know that every time they take antibiotics, they get a yeast infection or something, I'll prescribe stuff for that. But I'm not going to like, refill their meds that they can't get a hold of their primary for, or like overstep my bounds in those cases. Or I've had patients before where I've really wanted to, where like in a pre-op, I find out they're on blood thinners and I'm like, what do you take this for? And they say, I don't know. Like they told me I had a blood clot like 20 years ago and they told me I needed to take it for this amount of years, but then they keep refilling it and they never told me to stop. And I'm like,
no, you can stop.
Like, like I want to just tell you in those cases, I'm like, okay, I think you're okay to stop, but I want you to talk to them because now you're already giving me vibes that maybe you're not like super educated on what's going on. So like you figure that out. So I'm not the one to like, I don't know.
Yeah.
You have something else actually going on that you were taking it for.
Yeah. So, I mean, ethically, I think that there are lines, right? If it's in my scope of practice as defined by what I feel comfortable with and also what my doc would feel comfortable with, I feel like I could do that. Like the risk benefit, right? Like my dad, irrigating his ears. I feel like that was okay. Yeah, it was okay to do that, right? Removing a splinter from my nephew's foot. It was okay. I didn't love it, but I feel okay doing that.
Yeah.
Right. Repairing a laceration on my friend's shin. I feel okay doing that. If I were on a plane and someone's like, hey, is there a medical professional here? Oh, or story time. I was covering a football game and one of the coaches started having chest pain. So they came over to me and I was like, whoa. Like there's an EMT right over there.
Yeah. They know this more than
they
I
hooked
do,
him up to like the ACD just to get his his rhythm,
Mhm.
like to see what his heart was doing. And they're like, hey, what does it show? And I was like, oh, guys. I was like,
ChatGPT.
like these look so fast, but I was like, I'm not, don't take,
Asystole.
do not take my word for what is going on there. Like
Yeah.
that type of stuff. I feel like, whoa, way in over my head.
No,
right?
no, not anything that's like life or death. Absolutely not. That's where I draw the line.
Yeah, no.
I am not a critical care PA.
Right. But like the neighbor stuff, I had a neighbor who was in a motorcycle accident. He was by himself and he tried to jump a curb and literally like face planted. So he went to elsewhere and had mid-shaft clavicle fracture, among other things, whatever. And I didn't know any of this until the next day when his wife called me and was like, hey, so I'm out of town. I guess he got in this motorcycle accident. Is there any way you can go over to the house and like help him like get dressed and whatever? So I was like, what am I going to say? No.
Yeah.
So I was like, yeah, okay. So of course, then I'm over there. I'm like, hey, can I see, I'm going to see your x-ray. And they're saying, hey, it's non-surgical. I'm like, bro, that is 100%. Like, so now do I insert myself and tell him what to do? Then I'm looking at the meds he was given. I was like, I don't agree with that. Like, so I was like, oh, I'll help him get dressed. And I saved all my internal thoughts for whatever. But here's the thing. The orthopedic person that he was seeing, I was like, hey, that's what I do.
Yeah.
Like I do that. I actually do that on the shoulder.
Yeah.
And I had, recommended he come in and see us and he didn't. So here's the thing. Like I was asked to help a little bit. I was very available, but I got no business out of that.
Yeah.
So at the end I was offended.
Yeah. You're like, did you not trust my advice or did you just decide to take it and run with it elsewhere?
Or was it awkward with you that I had to get you dressed and now you didn't want to engage with me in that capacity? Because it was awkward for me. You know what I mean? But what are you going to do? His wife called and was like, hey, do you think you can go over there and help him? He literally cannot get dressed. And he didn't even have the strength to like get his pill bottles open. And I was like, oh my, okay.
You're like, I guess I'm a home health nurse now.
I know, but like I don't know.
Yeah.
I said yes.
Yeah.
It was consensual.
You help patients to the bathroom when you have done that before.
Oh my God. Yes.
You have done that.
Yes. Help patients to the bathroom. Oh my God.
Yeah.
Yeah. All those weird things. But it's half on them.
Yeah.
They take advantage. There are no boundaries. But it's half on us because we say yes.
I know.
All the time.
Yeah. I want to say yes to most things because I want the experience in it.
Yeah.
Like, will I ever get to pull a baby jaguar tooth out of somebody
ever again?
Unless it comes back, I guess.
I don't know.
Maybe we don't know.
Yeah. Last night, again, just closing, I was at a surprise birthday thing last night. And I remember a year ago, something like that, one of my friends was like, hey, my niece, she's like 16, 17. She's a cheerleader. She lives in Jersey. She tore her ACL. I told her that you do that. Do you mind looking at her MRI? And I was like formally, informally, are you going to screenshot it to me? Can you just tell me what it says? This is a 16-year-old tore ACL. I was like, oh, she needs to get that fixed.
Yeah.
That was it. I met the girl last night because she was in town, whatever. So my friend who was there was like, oh, hey, remember I told you I had this PA friend? So I thought it was going to be oh, hey, yeah, did you get that done? How does it feel? Like,
yeah.
I'm so glad you're on the other side of it. So it turned into, she got it done in December. It still bothers her. This is what they use for her graft. She ran out of therapy visits. Do I think she's cleared? And I was like, she had a dress on. She's like showing me her knee. Yeah. And then it turned into like, I want to go into occupational therapy. Can you describe the difference between the two? Do you think that this would be, if I were to do a college essay, do you think you can read it? And I was like, oh my God, stop talking. Like, it was so much. Yeah. It was so much. I thought it was going to be like a quick and easy, whatever. And it turned into like a lot. Yeah. But I was like flattered.
It is. It's like,
it's flattering. So part of me was like, oh, that was nice. But also part of me is like,
sometimes I'm like,
do you want to know anything about me? Like, you know what I mean? Like,
am I stroking my own ego by like, oh, they're asking me questions and like want my advice with it?
Yeah, but that has nothing to do with me. Like they weren't there to talk to me because I was interesting. They were there to talk to me because I served a role for them.
Yeah, they wanted something from you.
Yeah. So although flattering at first, I left and I was kind of like, that felt.
Am I used?
That felt like, used. Yeah. You know what I mean? Like, I don't know.
Like, never mind. I'm not going to use it.
Okay. Anywho.
Anyway.
But I think It's inevitable. Know your scope of practice, know a great way to get out of it, understand why we like to do that. And I think it's a nice balance between there's confidence from applying, then there's wisdom and knowing, going through this so many times, you eventually will know what you do and what you don't do.
Yeah.
You know, when not to, recognize when not to engage.
Yes.
So
agreed. All right. Well, next week is our birthday, our 1 year anniversary of our first episode. So, yeah, I'm going to do my hair a little bit different for that one. Since
little celebratory things also.
Celebratory things. Yes. And we'll break back out the video for that, I think, because it's a special occasion.
Perfect.
Yes. All right. Till next time.
Thanks for tuning in to Joint Effort PAs. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with a fellow PA or med-minded friend. You can also follow us on Instagram at Joint Effort PAs for updates and extra content. See you next time.